Hello, everyone. Welcome back to another episode of the AI Healthcare Podcast. I'm your host, Dylan Reed, and today we are joined with my friend Chris Mathew, who is the Chief Growth Officer of Well-Genie. Chris, thank you so much again for your time today.
My pleasure, Dylan. It's great to be with you, and thanks for having me.
It's also great to have a fellow Texan on too, as well.
That's right.
So just to start off the conversation, what led you into the field of AI healthcare?
Well, I've been working in and around healthcare for over 20 years now. A little over 3 years ago, I got the chance to really start getting involved with AI and its applications in healthcare. And Dylan, as you know, I don't need to convince you of this. It's remarkable what AI is going to be able to do. When I think about what AI is already doing and what it will be doing for the entire healthcare continuum, I really think that it is just an amazing opportunity for all of us. AI has the power to improve the processes for physicians and for clinicians and patients and insurers and carriers and pharmacy providers and the whole charting and coding and billing, and so much more, right? I just think that there's this incredible opportunity. And there are a lot of phenomenal companies that are already deploying this and making tremendous impact. One company that comes to mind is On Point Healthcare Partners and their Iris platform. It's amazing what it's doing for clinicians and administrators, and ultimately the positive impact it's making on patient outcomes and patient care. That's just one company of dozens that I know that are using the power of AI and people in the loop to make things better for all of us. And so these last 3 years, I've continued forward with my passion to try to support physicians and clinicians and patients, and want to be able to bring the best processes together to do that. And I think AI is going to be here to stay in support of that.
Awesome. And that leads into my next question quite nicely. So, what is the story behind Well-Genie?
Yeah. Oni Ryan is the president of Well-Genie, and she has a pharmacy business background, and she's been in the pharmacy space setting up physician dispensing for practices all around the country. She was talking with a friend of hers about the idea of, they were talking about Netflix, actually, right? When it comes down to it, it was the Netflix model, and like the whole world has gone to subscriptions. The whole world is streaming everything. The TV industry is completely radically changed. I mean, when you were living in Plano and I was, growing up in Plano as well, there was no streaming option, right? Everything was cable and satellite TV. But they were having this conversation about how the whole world has gone this subscription direction, and it dawned on them, why isn't something like that available in the pharmacy world? So the conversation kept on going, and what evolved from that is what is now Well-Genie. And so where Well-Genie is focused today, while there are lots of problems in the pharmacy ecosystem, lots of problems and lots of opportunities to be solved, what Well-Genie is focused on primarily today are generic medications, wellness tools, and the GLP-1 marketplace. So if you are a member of Well-Genie, you and your family have the chance to receive unlimited generic medications for $0. So the formulary that we have represents 93% of the most prescribed generic medications that are consumed in the US. If you are a member of Well-Genie, for the chronic care medications, they're going to be mailed directly to our members' homes with a 90-day supply. For the acute care medications, we're already integrated with over 64,000 pharmacies. You go to your local pharmacy, you show them your Well-Genie membership. Again, you're going to pay $0 and you're going to walk out with your generic medication. This solves a real big problem. And for us, it's how do we remove the friction and the burden of cost and access, right? While when you lived in Texas, you did not live in a rural part of Texas. Where we live is there's an abundance of people and resources, but there are still really rural parts of Texas and lots of states, lots of areas all around the country where it's hard to be able to get your medications. And also, when your physician prescribes you a medication, you may not be able to afford all of them, right? The average household in this country has 4 prescriptions. So maybe you can only afford 1 or 2 or 3 of those. So then you start making decisions. I know my physician wants me to get this medication, but I also need to fill up my gas tank. I know I need to get medication for my son, but I also got to pay the light bill. And so we realized, okay, maybe there's a different way to approach this, where we can remove those barriers and make sure that people get the right care at the right time, at the right place, for the right price. Dr. Scott Kennard talks about this being trying to get everyone back to the yellow brick road. And if we can all get on the yellow brick road, then we have an opportunity to get to really where we're going, where we can have a positive impact. So with us, it's acute medications, chronic care medications, generics only. And again, as a member of ours, you get those for $0. And then we have lots of wellness tools like BMI calculators, calories per day, target calculators, body fat percentage calculators, recipes, workout videos, access to discounted gym memberships. Those are kind of the traditional wellness tools that are out there. But then we've coupled to that unlimited virtual primary care visits, unlimited mental health counseling visits, the ability to access and ask questions to specialist physicians, and also to get support from patient advocates. Right, we brought all of that together with our membership program, and it's something we think that can really serve people in a very positive way.
Mhm. And what drew me to learn more about Well-Genie. So it aims to usher in a new era in non-insurance wellness benefits. And as the chief growth officer of the organization, what does that mean to you?
It means looking at the problem from a different perspective, right?
Hmm.
If we keep looking at everything, I'm not knocking the whole insurance ecosystem, but there are very bad actors out there that don't necessarily have our best interests. Costs keep going up and up and up, and even when we do everything we can to try to mitigate those costs, every employer group always gets an increase. They always expect these terrible financial impacts to their businesses, and for not only for the employers but also for the employees. So for us, when I say let's look at this in a non-insurance perspective, how can we bundle together a set of solutions and deliver maximum value to help people? Right? For me, I feel called, Dylan, to make a positive impact here in healthcare. Right? I've had
Hmm.
a personal tragedy in my life in the healthcare system that I never want to happen to someone else again. And part of that is not having the right advocacy, not having the right awareness, not having the right tools around me and my family to ensure that we were getting the right care at the right place, at the right time, at the right price, and all these, again, getting back to the yellow brick road.
Hmm.
Um, so for me, it's very much about how can this isn't always the way business has been done, a fresh set of eyes and a real solution architect mindset. And then what is possible, as opposed to just saying like, hey, nope, that's not possible, we can't do that. What is possible, and start at that place. And that's what we're doing here at Well-Genie.
And pre-Well-Genie, how were wellness benefits managed?
You know, again, wellness benefits have been around for a long time, right?
Hmm.
Access to nutrition trackers and um, food calculators, and again, weight loss, and tracking your steps. And if you take 10,000 steps, at least 80% of your work week, you qualify for these bonuses. And those things have been out there. The problem has been it's really hard to impact people's behaviors, right?
Hmm.
Because you don't have a good way to be able to inform them, educate them, and engage them to take action in these wellness programs. So um, there are probably wellness programs out there that have had tremendous success. There are probably more programs that have fallen flat or just didn't return any sort of a return on investment from what the employers or the groups may have thought when they implemented those. Where I see AI having the ability to really positively impact what wellness benefits can do, it's when it comes to how can we incorporate AI in the patient advocacy arena. How can we incorporate AI in the education arena and the engagement of these benefits? If we can inform, educate, and engage, then we have the ability to activate the employees to use these tools and to be proactive and not just think of this at that one time of open enrollment, that one time of year that no one really enjoys, but to be able to be informed and be a good steward of these tools and these resources that have been provided to them and to use them throughout the year.
Yeah, and you bring up an interesting point because I always thought that the reason why wellness benefits, or excuse me, wellness programs don't succeed is because it's too complicated for people to understand. And if it's too complicated, then 9 times out of 10, people aren't going to follow it.
Yeah. I mean, I don't think I'm very unique, Dylan. I think that I'm pretty similar. I'm trying to be a great husband and a great father and a great community member and juggling. My boys are on 5 sports teams right now. And so my everyday life is all over the place. So to try to recall that 1 hour that I spent in an open enrollment meeting, last fall, I just don't know that that's realistic for people, right? And so, but AI and smart marketing and smart educational approaches, we can inform people that you have these resources and these tools available to make your life better and to help you do more with less, right? And so
Mm,
it's not a destination, it's a journey. We have to constantly be in pursuit of that active advocacy and education and engagement.
hmm. Yeah, and kind of on the tech side of it, what I remember when I got one of my first iPhones, they had the kind of the health app, and it's the one with like the heart and tracking your steps. Like I remember like that was considered like revolutionary for the time when it came to tracking your wellness, and now you have all of these other gadgets and gizmos that are out on the market that consumers can purchase. So it's amazing just how much this field of wellness has totally exploded, it seems, within the last 10 to 15 years.
It is amazing. And the wearables, I mean, I'm addicted to this thing. Like now I'm trying to I'm tracking my sleep and I'm tracking my activity and I'm trying to see am I doing all the right things? And then, the Aura rings and all the different wearable devices have taken this to the next notch. But if that's one piece of it, we can't forget all the other elements of it. And part of that is it is mental health counseling
Mhm,
support. It is making sure you get good virtual, good primary care. We do virtual because that's part of our solution and our system. But if you have a local primary care doc, great. But sometimes it's not easy to necessarily get in to see these physicians. Clinics are backed up for weeks and months at a time to be able to get a new patient appointment. So virtual might be able to help, again, get people on the yellow brick road. And so that's why, again, it's all of these things working in concert together that we feel is going to be able to serve people at a high level.
mhm. And um, based off of the current uh, Well Genie members, like how has the general feedback been from using the service?
Well, it's been amazing. We've learned that roughly a little over 30% of prescriptions go abandoned at pharmacies. So your doctor prescribes you 2 scripts, you decide I can't afford this. Maybe I'll go get one of them, or they give you a series of a treatment protocol, but you can't afford to follow it, and so you take half a pill instead of the whole pill, or you take it every other day, and ultimately these little things become big things because we didn't follow the direction, the guidance from our brilliant clinicians that are in charge of our health and leading us in the right direction. So to hear from patients and members to be able to say, to not have that burden, to not have that worry, to be if my doctor says you need these 3 medications, if there's a generic opportunity for it, then I'm getting all 3 for myself, for my spouse, for my children. The Well-Genie platform, when we are delivering this to employer groups, this covers the employee and 4 dependents in their household. So unlimited generics for all of them. Chronic care is a big issue. We got a lot of consistently unhealthy folks around the country. Helping them get their medications and make progress will help those little things hopefully not become the big things that then have them admitted to the ERs and more complicated medical interventions, which ultimately then comes back to having a very positive or negative impact on the employer's health plan, right? If all of your employees end up getting sicker than they should, and they have and require more medical intervention, then your health insurance premiums are going up. Conversely, if we can get people the right medications and we can make it easy for them to be able to receive those medications and access those medications, and they take those medications, then hopefully we can help prevent that, along with some medications and talking to a counselor when you're stressed, and talking to a primary care doctor for ongoing routine maintenance, and being able to talk to a patient advocate to understand what resources are available. It's all of that kind of in an ecosystem that supports, again, hopefully is going to serve people and improve their lifespan and the quality of their lifespan to be better.
Mhm. So you guys really take a 360 approach to health overall.
We're trying, and there's still a lot of stuff that we haven't solved, right? Brand name medication. We have some solutions that we're testing and we're working right now. The GLP-1 marketplace is a really hot marketplace, and for good reason. There's these drugs can have tremendous impact. So we're trying to learn from what the marketplace is saying. We need solutions around these things, and we're trying to be really efficient and effective and innovative on how we can bring these solutions together. And again, from a non-insurance kind of a mindset.
Mhm. And you bring up an interesting point because when I was younger, and I don't want to age myself, but like 20 years ago, like I don't remember health having this like all-encompassing viewpoint that we seem to have nowadays. It was very, you had your wellness benefits, then you had your pharmaceuticals, then you had this group and then that group. Like there really wasn't any sort of kind of 360 approach that you're starting to see nowadays in the healthcare space.
Yeah, Dylan, everything, for a majority of the history that we've been on this earth, it's been all very siloed. But the reality is, remember that old song, like the head bone's connected to the neck bone's connected to the elbow. All of it is connected, right? And that's why I think patient advocacy in itself and patient navigation is one of the most powerful tools we can bring to people. Because if we can help people understand how all of these things are connected, then we have the opportunity to, again, move people forward in their health journey in a positive way. So they can, again, try to support them in getting on the yellow brick road and being able to receive an overall healthier outcome for all of the different health needs that they have. But if you only go to a primary care doctor and that primary care doctor doesn't talk to a specialist, and you don't know where to go get your imaging service, and you don't know where to get your medicines filled, and you're overwhelmed with your mental health not being in good standing, all of these things chip away at your overall health. But if we can coordinate and we can find a way to use advanced tools and AI and great people with tremendous intentions to support us along the way, then I think we're going to have the chance to really serve people in a very positive way.
Hmm. No, definitely. And um, you mentioned this a little bit earlier in the conversation. Like how do you want to see Well-Genie, further contribute to the greater AI healthcare conversation?
Well, we have some ideas around that. Again, I think for us, where we're going to put our emphasis is going to be how do we get AI to support in the patient advocacy way, in the education and engagement ways. For
Okay.
today, that's going to be kind of the path. There's, again, constantly new organizations and tools and data that comes available, and we may be able to find ways to take action on those other opportunities. But for today, I think we're going to be focusing on how can we purpose AI to support people in becoming to have more advocacy in their lives, to have better education around their resources and their tools, and how to better engage and activate those tools.
Awesome. And is part of the reason why it seems like throughout the past patient advocacy has kind of been on the back burner, is it because the patients themselves are so overwhelmed with kind of all of these vernacular terms in the healthcare system, or kind of what are y'all seeing in Well-Journey?
Yeah, I think it's very easy for people to be overwhelmed. This is not a knock against physicians or clinicians, but I think a lot of us, a lot of people listening and watching this have had the experience where you've gone to a doctor. You might have a little bit of eye contact, but the most of the time they're down looking to the side, taking care of their thing, and they're moving really fast because in the way of practice today has been fee for service. I think that's a bad model. It's transactional healthcare. And so that physician, and specifically in primary care, most primary care physicians are having to see somewhere between 24 to 30 patients a day. That's hard to be able to give tremendous quality care in that time frame. Physicians are doing amazing, heroic things, but it's also really the deck is stacked against them as well. So they're having to move at a rapid pace and not be able to maybe give the quality care that they went into. When a physician chose to go to medical school and chose to be able to go through the burden of medical school and residency and fellowship and then training and licensing and all of that, it was not to be a hamster on a hamster wheel cranking out patient visits. So I believe that AI
Mm-hmm.
and organizations like Well-Genie are trying to come alongside and figure out where are those areas and opportunities that we can be intentional about returning um, kindness back to healthcare and advocacy back to healthcare, and allowing that patient, if the physician can rely on better AI tools to support them in their everyday life, then maybe the patient has the opportunity to get a little more eye contact with the physician. And maybe the physician can then see this patient doesn't seem like they have clarity on what I'm saying. I'm going to spend a little bit more time explaining what this term means, or what that procedure means, or what this drug is going to do.
Mm-hmm.
But it's also on patients to equip them and inform them. Our mutual friend, the great Tiffany Ryder, she and what they're doing at Red Flag Hero, I think, is incredible to help patients realize it's okay for you to ask questions. In fact, it's your responsibility to ask questions, to be an advocate for yourself and for your loved ones. That's ultimately, where we got to get more clarity in the system, from patients to physicians and everything in between. And if we can do that, then I think people are going to be able to have better outcomes, period. But we have to
Mm-hmm.
find a lot of solutions and tools to support that ecosystem so that people can, because one thing I do believe, AI is not going to replace the empathy between a physician and her patient. When that patient is scared or nervous, the empathy that comes from that clinician, that physician, Tiffany in this example, that can't be digitized, in my opinion. It shouldn't be, right? And
Mm-hmm.
so, kind of rambling there a little bit, Dylan, but I get excited about these things.
Yeah, no, definitely, and it's so, and and you bring up an interesting point too as well, and I hate to say it's obvious, but I don't think it really gets talked about, is we just do a bad job in the United States of educating people on what health is, and how do you get good health, and how do you manage and maintain good health.
Yeah, you're right. Listen, I know I have lots of physician friends and family members, and I've been working with physicians and clinicians all around the country for 20 plus years. More and more, this conversation's been coming out, and that is a majority of physicians have had one nutrition class their entire medical training, right? And some of them none, right? Some of them that nutrition class was optional. Physicians aren't necessarily taught how to tell
Hmm.
people how to eat healthy. And when we were in school, you had the food pyramid, which turns out that's not necessarily the right way to be looking at your food intake, right? And so there's 1,000 fad diets out there, but the foundation of what is proper eating, and it can be different for all of us because we all have different genetic makeups. It's, one type of food may do phenomenal for my being and may completely wreak havoc on your being. And so it's not just an easy answer of just eat more green vegetables. Although I say that to my boys, but it's more complicated than that. And I think that you're right, that patients don't know exactly the questions to ask, but also what it means to be healthy for them. They can see a picture of it online. They can open their phone and see, oh, that person, how does that translate to their life and what they do in their everyday life? Will things not become the big medical things in their own personal lives?
Mm-hmm. No, definitely. And then, I would also like to add, you also have to make it easy, um, for companies too, as well, to help them meet, in this case, the patient, which is also their customer too, as well.
I agree.
Um, and my last question that are, since this, uh, got to include some policy in here too as well. So, what do you think policymakers need to understand when constructing, ideas that impact wellness benefits?
I really like that question. Off the top of my head, the way that it's always been done before is
Hmm.
not the way to default to.
Hmm.
We have to look at this from a different perspective and new information. I mentioned earlier the the TV, cable and satellite TV companies. And I do know a few people in my life that still have cable. My mom is one of them. She's just comfortable with it, right? That's just her system, and that's just going to be. A majority of people, though, have gone to these streaming platforms, and the streaming platforms have become to offer more and more and more. And it's a robust, whole new place where cable TV and satellite TV thought that they were unbreakable. And now you have streaming, and it's complete adoption because it serves people better. It gives them more of what they want on their terms, and it's easy for them to use. I think
Hmm.
we have to look at wellness in that way as well, healthcare in that way as well. How do we not just come up with a system that's like blanket for the entire country? How do we? So there's some absolute things that we have to be able to provide as an entire country, but how do we have solutions that are bespoke to people, right? And that can also scale. And I think wellness benefits have that opportunity. If you bundle the right solutions together and make it easy for people to access and become informed and educated and engaged and activated around those tools, then you make it easy for people to be able to be proactive in their healthcare and get take the necessary steps because they've been informed. And I think, well, I hope at least that's what we're doing at Well-Genie, and I hope that the marketplace will see that and meet that with enthusiasm and give feedback and say, this is where you're getting it wrong, and this is what we really want, because we are committed to evolve to serve people better. And so
Hmm.
my hope is that policymakers will look at that and say, the BUCAs and the way that they do things and the way that insurance has been done for the last 20, 30, 40, 50 years, maybe it doesn't have to be that way anymore. And what questions should we be asking? And what other ideas and approaches should we be considering? And the what ifs that are out there.
Yeah. Well, and I also, might I also add, throwing a bunch of money at a particular initiative doesn't solve the healthcare crisis in this country either.
Completely agree. Because if ads are being thrown at people and it's just washing over people, if it's not connecting to them, which is where I think that bespoke marketing and that bespoke messaging has to take place. You have to find a way to make these solutions connect to the individual. Because if they don't connect to the individual, then it doesn't matter. It's great. I'm sure there are companies out there that have developed amazing solutions and technologies, but no one learned about it, became informed and educated. No one engaged in it. No one activated it. And because of that, the solution died and went away. It could have been a remarkable tool to make a tremendous impact for people. But that's just half of the equation, right? You got to bring an amazing solution, but then you've got to also make it easy for people to embrace it into their everyday lives.
Hmm. I like to say it's the 2 + 2 = 4 type of mentality. You uh, really have to bring for people, because people aren't going to take the time to figure out how something works.
Yeah, they're busy. Life's busy.
Hmm.
Life's got a lot of complications today, and not let that it was easier yesterday. Not that it's going to be easier in the future, but it is our responsibility. For those of us that say we want to bring new solutions to the marketplace, the responsibility is on us to try to figure out how to solve these things.
Definitely. And Chris, where can people find more about you as well as Well-Genie?
Um, you can find me genie.com, like wellness hyphen genie. One of our lines is your wellness wish is granted. So Well-Genie, well-genie.com. I'm Chris at well-genie.com. And you can find me on LinkedIn as well.
Awesome. And don't forget to subscribe to the AI Healthcare Podcast YouTube channel, as well as listen to the audio version of this podcast on Spotify and Apple Podcast. Chris, thank you so much again for your time today. Really appreciate it.
Dylan, it's been my pleasure. Thank you.
This is Dylan Reed signing off.